Hey there, how you doing today? My name is Samsarah Morgan. I am an SMC Full Circle Doula certified trainer, and I'm very happy to be with you today. What we're going to do is to discuss some of the more common concerns in pregnancy and what we can do about those things. There are things that pretty much most pregnant folks are going to experience in some way or shape or form. They're relatively minor, and they're very addressable, very fixable. So we're going to talk about things like morning sickness, constipation and hemorrhoids, varicose veins, indigestion and heartburn, and backache. So that's what we're talking about today. Starting with morning sickness. Morning sickness is most likely caused by hormonal changes. There's some studies that support that some level of morning sickness is actually a sign that the pregnancy is healthy. So not anything to be concerned about. We will also want to keep things on a level where things stay healthy. So it should be relatively minor, an inconvenience, but not debilitating. How's that? Morning sickness usually improves by the 14th weekish of pregnancy, although rarely can go on longer for some folks. But for the vast majority of pregnant folks, around 14 weeks, it starts to taper off and then things get a lot happier. Morning sickness doesn't just occur in the morning. So it's important to know. Sometimes it can occur at any other points in the day. It tends to be worse in the morning, and that is believed that your blood sugars are lower in the morning after a night of sleep and a night of not eating, 8 to 10 hours of not eating. Your blood sugar is low when you get up in the morning. That's why breakfast is so important. And so that imbalance, along with your body adjusting to a new pregnancy, can make morning sickness worse in the mornings. Nausea or vomiting can be made worse by things like stress, a poor diet, especially if you're eating a lot of greasy or fatty foods. Can be caused by skipping meals. It's very important not to skip meals in pregnancy. Baby eats 24 hours a day. And so it's important for us to keep ourselves, as a pregnant person, keep yourself well nourished so that you're constantly feeding your little one and allowing for that 24-hour cycle in your baby's life of growth and development. It doesn't take breaks, and it needs fuel all the way through. Sometimes vomiting and nausea can be caused by prenatal vitamins or supplements being taken too soon. Very often it's more helpful to take your prenatals and supplements with a meal and with lots of water to make sure. But that's a reaction that some folks can have. Morning sickness and vomiting can be improved by eating smaller meals at a time. So as opposed to 3 meals a day, you're wanting to maybe get 6 meals a day, spread it out during the day. As long as you're getting the appropriate amounts of protein and other important nutrients, just breaking it out throughout the day so that your tummy has time to deal with a smaller load each time. You want to eat regular meals and healthy snacks. Again, remembering that baby needs to eat 24 hours a day. And so when you're up and about, you may not even feel hungry, but it's important to know that your growing infant needs that nutrient. And sometimes denying yourself that nutrient can result in you feeling very poorly. You want to increase your fluids. You want to make sure to not get hydrated. Not get dehydrated. You want to be hydrated. Don't be dehydrated. The dehydration causes stress to the body and can definitely have you feeling very, very poorly. Definitely want to make sure you're getting adequate rest, as well as enjoying mild exercise. A daily walk would be wonderful out in the fresh air. Would be incredibly helpful just in your general body and helping all the systems of your body work productively. Us being in motion, we're not sedentary creatures. We're creatures that are built to be in motion during the day. So as much as exercise as you can, that would be great. If you're a person who's already pretty athletic, trying to maintain, might take it down a couple of notches, but try to maintain. If you're a person who went to the gym, talk to the folks in the gym about how to change your routine to accommodate the fact that you are pregnant. But definitely you want to continue your healthcare regimen as you had before you were pregnant. Now is not the time to up things, but definitely maintaining being an active, outgoing person is very good for your physical health and your emotional health as well. You want to avoid foods that increase nausea, foods that are greasy and pungent and spicy foods. Sometimes just being a pregnant person in those first few weeks of pregnancy, you just adjust everything. It has to be readjusted to. So even things and smells that you were perfectly fine with before become a problem. Hopefully that will be temporary, but during this time you just want to back off of those things right now to avoid feeling nauseous and feeling that you want to vomit. Teas might be incredibly helpful. Ginger tea, peach tea, or lemon tea. Those teas all contain nutrients that help settle the stomach and improve digestion. So those might be just really wonderful to try during this time. Ginger ale is very helpful, and we're talking about actual natural ginger ale, not the stuff that's filled with sugar or high fructose corn syrup. Too much sugar, not a good idea. High fructose corn syrup, we don't even know what that stuff is. Our poor bodies can't digest it, and it will cause more trouble than it's worth. But if you get a brand of ginger ale that is actually a natural ginger ale, and you'll see in the ingredients, ginger is present, that might actually be very, very helpful. And the fact that it's a carbonated drink, sometimes just having a little burp or two, actually settles the stomach and feels good. You want to eat dry foods, toast or crackers. Sometimes that's good to have first thing in the morning as you're just rising. Saltines we're talking about, or just like a dry toast just to chew on first thing in the morning. That can help settle things amazingly. You want to honor healthy cravings. If you're craving healthy foods, definitely let yourself have them. Fruits, vegetables, healthy proteins, meat if you're a meat eater, but other forms of protein if you're a vegetarian. Just letting yourself have those things definitely can help things remain in good balance. And if allowable in your state, if legal in your state, medical marijuana has been very helpful in dealing with issues of morning sickness, nausea, and vomiting. You want to check with the appropriate healthcare practitioner to assist you in the best way of consuming that medication in your pregnancy, or discuss it with your midwife as well, and see what would be a good path for you along those lines. Constipation and hemorrhoids. In pregnancy, food moves more slowly through the intestine to allow better absorption of nutrients. Those nutrients are going to be directed towards your beautiful baby and help that baby grow and and be healthy and change and get ready to live its life outside of your body. So that slower pace in your intestines can also be the cause of constipation and or hemorrhoids. Pregnancy hormones can relax the veins, and they also contribute to hemorrhoids based on poor food choices and straining, and that can also lead to varicose veins. This condition can be made worse by long hours of standing at work, long periods of sitting, low fluids, straining with bowel movements. Iron supplements or vitamins sometimes can cause harder stools. Women who take additional iron might find that this worsens the problem. You want to go to your healthcare provider, your doctor, your midwife, and find out if there might be other kinds or brands of supplements that you can take that will help alleviate this problem for you. Constipation and hemorrhoids can be made better by increasing fluids, especially water. Nothing is a replacement for water. You need 8 to 10 glasses of water a day in your pregnant body to help hydrate you and to help remove waste products from your body as well as the baby's waste products from your body. 8 to 10. Again, it could be made, things could be made easier by changing the brands of vitamins that you are taking. So you want to discuss that with your healthcare provider. This is another condition that responds well to exercise, especially walking. That kind of gets the intestinal system going and moving. Even though it's more slow, it just helps things to move along more efficiently and relieves a sense of constipation. You want to make sure you're having regular fiber in your diet. And so fruits, vegetables, and whole grains. Putting your feet on a low stool or a phone book while you're on the toilet might help reduce the strain. All that extra fiber, again, we're helping to get things moving through your intestines and have nothing be kind of stuck in there and result in you feeling bloated and feeling uncomfortable. I'm going to check with your healthcare provider around what preparations are safe to use in pregnancy, things like preparation H. Always double check those things before you use them, and if you get the okay, and if they are helpful, please feel free to do that. Comfrey or calendula creams or compresses on hemorrhoids are definitely very, very, very helpful. Witch hazel wipes are incredibly helpful. You can get actual witch hazel. You can get the actual herb of witch hazel and make a tea. And then on little cotton swabs, you can swab the hemorrhoids with that pure witch hazel tea. And that can actually cause the hemorrhoids to shrink. You can take baths, taking sitz baths with herbs in it, such as the pure witch hazel. You can make a tea out of that. You can also add things like comfrey leaves and calendula flowers and make a tea of all of those things, and then sit in the sitz bath, then just soak the area where the hemorrhoids are. That definitely will feel very, very refreshing. You can reposition hemorrhoids if they're protruding after a warm bath. Gently reinsert while sitting in the tub. You can do Kegel exercises a few minutes, several times a day. Kegel exercises are the exercises where we tighten our perineal muscles and kind of hold them for a while. Hold them gently to a count of 10 and then release with a breath. Breathe in, hold those muscles, and gently release to a count of 10. You want to do that several times a day, and that helps strengthen that entire area as well as strengthening the area that's needed to help hemorrhoids heal. Want to keep bowels loose by eating stewed or dried fruit or prunes. That's a good old-fashioned recipe. I'm sure grandmothers have mentioned that to you. Definitely those fruits are very helpful in keeping everything moving. And some juices will soften the bowels as well. Apricot juice, prune juice, pear juice, very helpful. You want to avoid laxatives and enemas because they tend to be very, very harsh on the body. And you're already uncomfortable. You don't need a product that'll make you more uncomfortable. The next thing we'll be discussing is varicose veins. Varicose veins have similar causes and treatments as hemorrhoids. Varicose veins are caused by hormonal changes and pressures and are made worse by long hours of standing. Some believe that keeping the bowels loose will improve varicose veins as well as hemorrhoids. Something to consider. Other treatments that may bring relief would be raising the foot of the bed or mattress an inch or two. Sit or sleep with your feet elevated. Putting on support hose first thing in the morning before getting out of bed has been very helpful for some folks. You want to talk to your provider for details on this, or talk to a doula or midwife about that. Calcium and magnesium supplementation has been very helpful for a lot of people. Again, it's something to talk to your provider about. Midwife would definitely know about it. Some doctors advise women to take a baby aspirin to prevent blood clots, regular daily walks to strengthen muscles and keep blood moving, and strengthen circulatory system. That's something to discuss with your healthcare provider to decide whether that's a good idea for you. You want to avoid long hours on your feet. You want to avoid prolonged hours of sitting, which might be challenging for some of the work that we do. You might want to bring your birth ball into the office if you're working in an office and kind of sit on your birth ball and kind of keep things moving. That might be very helpful. You want to avoid crossing your legs while sitting. It's always a problem to do that. Crossing your legs while sitting also encourages baby to potentially get into not the most productive positions for birth. It might look cute in our modern society, but biologically, it's not the best way for us to be sitting and holding our bodies. You want to avoid wearing tight or restrictive underwear or socks. Anything that's binding and that blocks circulation could increase the problems with varicose veins. Leg cramps are something else that people will very often experience in pregnancy. It's very common. They especially occur at night. It may help tremendously to increase your calcium intake. Eat more dairy products if you're not lactose intolerant, or to take calcium supplement. Calcium carbonate pills are the least expensive, and they also help with heartburn. If it happens in the back of the leg, push down on your heel while curling your toes upwards. Just kind of stretch the muscle out, and you'll feel the cramp ease. With warm packs or heated rice socks to help treat and prevent cramps and improve your calcium and potassium intake, either by taking a supplement or even eating things like a banana every day that has a good healthy dose of potassium and calcium in it. Indigestion and heartburn can be caused by hormonal changes, but also made worse by pressure on the stomach as your uterus grows with your baby inside. Indigestion and heartburn can be made worse by spicy foods, greasy foods, heavy meals, drinking liquids with the meals, laying down too soon after eating. Can be improved by milder foods, avoiding greasy, fatty foods, staying upright for 2 hours after a meal, eating earlier in the evening rather than eating late and then going right to bed. Common remedies for this would be calcium tablets, papaya enzymes, or dried papaya, or even fresh papaya is very helpful. Raw celery is helpful. Raw almonds or raw cashews. Peppermint or chamomile tea, very, very helpful. Ginger again. Ginger is just a wonderful all-purpose healing kind of herb. Dried or candied, you can make a tea by shredding ginger root into hot water. Apple cider vinegar is a surprisingly effective old-time cure. It's one of the things our grandmas taught us about. Put a tablespoon with a little honey in hot water and drink like a tea. The idea behind it is that acid stomach may actually be an alkaline condition, that a mild acid such as vinegar will help to bring balance. Old-time advice, eat a pickle or a teaspoon of sweet pickle juice. Lemonade, cold or hot, may help balance acids as well. Yogurt or acidophilus are recommended for any malady of the stomach or intestines, heartburn, nausea, gas, diarrhea, stomach, flu. Over-the-counter products, again, check in with your medical provider or your midwife to see what over-the-counter products might be helpful for your situation. There's an exercise called the Flying Angel. Sit up tall and flap your arms up and down like a bird, high enough so that the hands meet above the head. And I'm sure that's about expanding the diaphragm and making room and relaxing. I can see how that would be very helpful. Aloe vera juice is also very helpful. 2 tablespoons combined with liquid chlorophyll. Mint is helpful. 1 teaspoon taken 1/2 hour before meals. And this is a cure that very many naturopaths will recommend. You can find some relief with a deep bath or hot water bottle. Juice a cabbage and drink 1 cup 3 times a day. So lots of different ways to manage that condition. Backache can be caused by softened ligaments. Your entire body is creating a hormone called relaxin, and it does relax everything in the body. So your ligaments are also becoming softened, and then you have the additional weight of a baby growing inside. That might pull on the lower back and make the lower back rather achy. This might get better as the baby moves lower in your pelvis and relieves some of that pressure. The condition can be made worse by long hours of standing or sitting, poor posture when you're sitting. If you're lifting heavy objects or carrying heavy purses or diaper bags, you might want to get purses and other things that have wheels so that you're not lifting them up. Can be improved by better postures, standing up straight and tall, using good body mechanics, bending down at the knees when you need to pick something up rather than bending over and putting all that weight on your back. There's maternity girdles and support devices that can be helpful for a lot of folks. You're sitting in a proper position, upright chair, pillow to support your lower back when you're seated. Having the belly wrap to take the weight of your belly off your back would be very, very helpful, and we'll be learning about belly wrapping later on. It's incredibly helpful an indigenous way to manage the ache of backache in pregnancy. Exercising, incredibly important. Exercises such as crunches, or gentle modified sit-ups, or lunges are very helpful as well. Gentle twisting is very helpful as well. Everything very, very, very gentle. Swimming, excellent. If you can get to swim, go do that. It's great for your entire body, relieves stress off the entire body, works every muscle in your body in a gentle way, and helps everything to just kind of come to a good place, come to homeostasis, which is a place of balance and peace. You wanting that as much as possible throughout your entire pregnancy. Let's see now. Backaches can be made infinitely better by massage. So definitely, if you could see a massage therapist, that's great. But even having a loving partner or family member give you a nice deep massage could be incredibly soothing. Warm packs, hot packs, liniments, oils. Arnica is another wonderful oil that's really good for traumatized muscles or unhappy muscles. So if you have some arnica oil and massage into your back, that might be incredibly helpful. I love arnica. I wouldn't be able to live without it. There's more herbs that can be used to made into a rub, and we'll talk more in this training about how to make healing oils. That'll be coming up, I'm so sure. So there are other herbs such as St. John's wort, or St. John's wort would be very helpful to be used, mixed with another carrier oil and massaged. You could actually even mix arnica oil and the St. John's wort oil together and make a really powerful massage oil. And if it's possible, and if you can, please feel free to see a chiropractor. There are chiropractors who are are specifically trained in taking care of pregnant bodies and newborn babies. One of the techniques of chiropractic is called Webster technique, that's specifically for pregnant bodies, and incredibly helpful in dealing with all the discomforts. Really, actually, all the discomforts that I have discussed can be helped with chiropractic and acupuncture and seeing a naturopath. of course, midwives and, of course, holistically minded doctors. Please bear in mind that all of these conditions for most people are temporary. Again, very, very, very addressable, very fixable, temporary. And once you meet them, you meet the needs of them, the needs for self-care. You know, so many of these things are about how we're eating, how we're living, how we're thinking, how we're feeling. So we want to be encouraged to be in your best light, to eat as well as you can, to gather your village around you and let them love you, let them be there for you. Eat super, super well, all your food groups. And any discomforts that you're having, again, will be temporary, and you will get on to looking back on the pregnancy that was filled with joy and was filled with overall very, very good health. So it's a pleasure for me to talk to you about all of these things today. I look forward to seeing you again another time. I wish you peace and blessings and best of luck in your training to be an SMC full circle doula.